So misleading before and afters on social media has been a hot topic lately, and I thought this article from Psychology Today was interesting because it presented a little bit of the actual data about how often this happens. So in this review, they talk a little bit about the motivation for surgeons to do this, and I think it's probably pretty obvious to most people that people are misleading with their befores and afters because they look better when they're misleading, and a better before and after potentially drives more patients into your practice. So in this review, they looked at two different studies, and I'll put the PMID of both the studies in the comments. But this first study right here, they looked at Instagram, and they pulled up over 500 different posts from 100 different practitioners, and they looked at a total of over 2,000 photos with a standardized scoring system. So they wanted to look at the photo quality for the befores and afters. So what they found was pretty depressing, in my opinion. So of these 2,000 photos they looked at, they found that over 40% of them were considered low quality. And when they looked at plastic surgeons versus doctors that are practicing outside of their scope, they did find plastic surgeons did better with a score of 4.5 out of 9 versus 3.1 out of 9, but that's still pretty bad. I think that as plastic surgeons, we really need to hold ourselves to a better standard. They also mention in this review is that the photos that are most likely to be misleading and of poor quality are lip filler and rhinoplasty. And one of the reasons why is these before and after photos are commonly taken immediately afterwards. So you'll see a lot of on-table photos for rhinoplasty and immediate afters for lip filler. And this is not always indicative, and it's often not indicative of your final results 6 months or more after your procedure. So in this second study that they looked at, it was also from Instagram, they looked at hashtags that were associated with common aesthetic procedures, and they had 3 plastic surgeons grade these photos, and they came up with a bias score. So I think what is interesting in the results from this study is that only about 27.5% of top posts for these hashtags came from actual plastic surgeons. And what they found is when evaluating the photos, accounts that have the highest bias score, so the photos were the most manipulated, were associated with accounts that had the most followers and the most engagement, and also accounts out of Asia. So one of the conclusions they came to is that there is a reward if you show a highly biased photograph because you get more engagement, more potential followers, and more potential work. One of the things that they say in this review, which I think is interesting, is that plastic surgeons maybe should put disclaimer on photos that are not taken in a standard way. So for example, if you're showing an immediate after, you say, hey, this after is immediately after the surgery, and immediate results are often not indicative of long-term results. And I think as a consumer, you need to be very cognizant of what you're looking at on social media. I've done a few videos that are in my random plastic surgery info playlist that talk about all of the ways in which before and after photos can be manipulated to make the after look better. And I think, again, it's really important that you are an educated consumer. And then also plastic surgeons need to hold themselves to a higher standard. When we are putting our results online, we need to put them out in a standard way. Same room, same lighting, same expression, same body position, and they should be 6 months or more after the procedure. So when a patient signs up for any plastic surgery procedure, they're taking on potential risk, and they deserve to know what an accurate representation of an after is. And our job as surgeons, as educators, is to give them that and not put things online that we aren't proud of and that misrepresent what the final result is.